Have you ever wondered what are the most common lung diseases, how they affect us, and how we can prevent them? From the subtle twinge of asthma to the life-altering impact of lung cancer, these conditions pose a significant threat to our well-being. Our lungs, those intricate organs responsible for the simple yet vital act of breathing, demand our attention and care. So let's delve into the world of lung diseases and explore the unseen. Join us as we count down the top 10 lung diseases, their symptoms, treatment, and prevention. Starting our countdown at number 10, we have asthma. This common lung disease is characterized by inflamed airways that constrict and swell, leading to difficulties in breathing. Asthma symptoms can range from shortness of breath and chest tightness to coughing and wheezing, especially during the night or early morning. While there's no cure for asthma, it doesn't mean that it can't be managed effectively. Treatment options often involve the use of inhalers to relax the muscles around the airways, or long-term control medications to reduce inflammation. Prevention, on the other hand, is largely about knowing your triggers and doing your best to avoid them. Common asthma triggers include allergens like dust mites, pet dander, and pollen, as well as irritants like smoke and strong odors. Regular exercise and a healthy diet can also help manage the condition effectively. Asthma can be a challenging condition, but with proper management it can be controlled. At number 9, we have pulmonary edema. This is a condition where fluid accumulates in the lungs, often due to heart problems. It's like trying to breathe underwater, and that's as scary as it sounds. Symptoms can vary but often include shortness of breath, chest pain, and coughing up pink, frothy sputum. Imagine gasping for air while sitting still, a feeling of drowning on dry land. So how do we treat it? Typically, it involves addressing the underlying cause, such as heart failure. Medications can help your heart pump more effectively, and oxygen therapy can assist with breathing. But prevention is always better than cure. Managing heart conditions, living a healthy lifestyle, and regular checkups can significantly reduce the risk of developing pulmonary edema. Let's not forget, this is not a wait-and-see condition. If you or someone you know experiences these symptoms, seek medical help immediately. Pulmonary edema is a serious condition that requires immediate medical attention. Coming in at number 8, we have tuberculosis. This is a serious, often deadly infectious disease that primarily affects the lungs, but can spread to other parts of the body. It's caused by a bacteria named Mycobacterium tuberculosis. Common symptoms include a persistent cough, fatigue, weight loss, fever, and night sweats. Tuberculosis is a tricky disease. It can be latent or active. With latent tuberculosis, you have the bacteria in your body, but it's not making you sick and you can't spread it to others. However, it can turn into active tuberculosis, so treatment is crucial. This typically involves a course of several antibiotics taken for 6 to 9 months. The key to prevention is early detection, isolation of those infected to prevent spreading, and proper adherence to treatment protocols. Vaccination with the BCG vaccine can also offer some protection, especially in children. Remember, early detection and proper treatment are key in managing tuberculosis. At number 7, we find pneumonia. A common yet potentially serious lung disease, pneumonia occurs when the air sacs or alveoli of the lungs fill with fluid or pus. This illness can manifest in a variety of symptoms, including cough with phlegm or pus, fever, chills, and difficulty breathing. There are several types of pneumonia, including bacterial, viral, and fungal, each with their unique treatment methods. Bacterial pneumonia is often treated with antibiotics, while viral pneumonia may be managed with antiviral medications and rest. Fungal pneumonia is typically seen in people with chronic health problems or weakened immune systems, and is treated with antifungal medication. Prevention, as in many health scenarios, is key. Vaccination can prevent certain types of pneumonia and the flu. Hand hygiene and not smoking also play a significant role in prevention. Pneumonia is a common lung disease but can be prevented with vaccination and good hygiene practices. Halfway through our countdown at number 6, we have chronic obstructive pulmonary disease, or COPD. A long-term lung ailment, COPD is characterized by obstructed airflow from the lungs that gradually worsens over time. It's often a mix of two conditions, emphysema and chronic bronchitis. Symptoms typically include breathlessness, persistent cough, and frequent respiratory infections. Diagnosis usually involves a simple breathing test called spirometry, which measures how much air you can breathe out in 1 second. Treatment options for COPD may encompass lifestyle changes, medication, and in severe cases, surgery. Prevention is key though, and that primarily involves avoiding tobacco smoke, minimizing exposure to air pollutants both indoors and outdoors, and getting vaccinated against influenza and pneumonia. Early detection is vital, as it can help manage the symptoms and improve quality of life. COPD is a progressive disease, but its progression can be slowed with proper treatment and lifestyle changes. Cracking the top 5, we have lung cancer. Lung cancer, a deadly disease, originates in the lungs but can metastasize or spread to other parts of the body. It's characterized by uncontrolled growth of abnormal cells in one or both lungs. Symptoms often include a persistent cough, chest pain, hoarseness, weight loss, shortness of breath, and recurrent bronchitis or pneumonia. There are different treatment options available depending on the type and stage of the lung cancer. This may include surgery, radiation therapy, chemotherapy, targeted therapy, or a combination of these. However, the effectiveness of these treatments can vary, and they can also have side effects. To prevent lung cancer, it's critical to avoid smoking, limit exposure to secondhand smoke, and test homes for radon, an invisible, odorless, tasteless radioactive gas that can cause lung cancer over time. Regular screenings are also recommended, especially for those with a high risk. Lung cancer is a serious condition, but early detection can greatly improve prognosis. At number 4, we have pulmonary fibrosis. This lung disease is characterized by a progressive and irreversible decline in lung function. The culprit? A buildup of scar tissue in the lungs, which makes it increasingly difficult to breathe. Symptoms of pulmonary fibrosis often include a persistent dry cough, shortness of breath, and fatigue. These might seem common, but if they persist, it's crucial to seek medical attention. In terms of treatment, there's no cure yet for pulmonary fibrosis. However, medications can slow the progression of the disease and ease symptoms. Lung rehabilitation and oxygen therapy can also make a significant difference in managing the condition. Prevention, as they say, is better than cure. While you can't always prevent pulmonary fibrosis, reducing exposure to environmental pollutants and quitting smoking can lower your risk. Pulmonary fibrosis is a challenging condition, but treatment can help manage symptoms and improve quality of life. And remember, early detection can make a world of difference. Coming in at number 3, we have cystic fibrosis. This is a severe genetic disorder that primarily affects the lungs, but it can also impact the pancreas, liver, kidneys, and intestine. It's characterized by the excessive production of thick, sticky mucus that can clog the airways and trap bacteria, leading to recurring infections and progressive lung damage. Common symptoms include persistent coughing with thick mucus, wheezing, breathlessness, and frequent lung infections. In the digestive system, it can cause poor weight gain and growth, intestinal blockage, particularly in newborns, and severe constipation. Treatment for cystic fibrosis is focused on managing symptoms, slowing disease progression, and improving quality of life. This might include respiratory therapies, medications, and in severe cases, lung transplant. Prevention, however, is a bit tricky as it's a genetic condition, but genetic counseling can help prospective parents understand the risks. Remember, cystic fibrosis is a genetic condition, but with proper treatment, patients can lead full and productive lives. At number 2, we have pulmonary hypertension. This lung disease is characterized by increased blood pressure within the pulmonary arteries, the vessels that transport blood from the heart to the lungs. Symptoms can often be subtle and may include shortness of breath, fatigue, and chest pain. Now let's talk about treatment. While there's currently no cure for pulmonary hypertension, treatments can help to reduce symptoms and slow the progression of the disease. These may include medications to relax the blood vessels, anticoagulants to prevent blood clots, and in severe cases, lung transplant may be considered. As for prevention, there's no guaranteed method to avoid pulmonary hypertension. However, you can reduce your risk by maintaining a healthy lifestyle. This includes regular exercise, a balanced diet, and avoiding activities that can increase your blood pressure, such as smoking and excessive alcohol consumption. Pulmonary hypertension can be a life-threatening condition, but early diagnosis and treatment can significantly improve the prognosis. And at number 1, we have COVID-19. This disease, caused by the SARS-CoV-2 virus, has left an indelible mark on the world, forever altering our perception of health and wellness. COVID-19 primarily affects the respiratory system, with symptoms ranging from mild cough and fever to severe pneumonia and even acute respiratory distress syndrome in extreme cases. There are several treatment options available, including antiviral medication, immune-based therapies, and supportive care for severe cases such as oxygen therapy or mechanical ventilation. However, the most effective way to combat COVID-19 is through prevention. Vaccination is the primary method of prevention, providing immunity against the virus. Other preventive measures include wearing masks, especially in crowded places, and practicing social distancing to limit the spread of the virus. COVID-19 is a global pandemic that has affected millions of people around the world. Vaccination, wearing masks, and practicing social distancing are key in preventing the spread of this disease. And there you have it, the top 10 lung diseases. From asthma to the infamous COVID-19, we've journeyed through a diverse array of conditions that reaffirm the critical importance of maintaining lung health. Early detection is key in managing these diseases, with prevention always being the best cure. Knowledge is power, and being aware of these conditions can potentially save lives. Remember, your lung health is important. Stay informed, stay safe.